Program lead. Thank you. Good evening, interns. I have good news for you. This is the last time you are ever going to have to listen to me as an intern or a student of our undergraduate program. I have no PowerPoint presentation. I think I've done quite enough of those with you over the years. So I just want to talk to you. And what I want to say is, it's so good to see you back here in UCC at the end of your internship adventure. And what an adventure it has been. This is not the way I had envisioned marking your end of program celebration. Because I know for your class, there is most definitely a sense of sadness and loss in the context of COVID-19. There is a sadness of not being able to come together as a full group here in Brookfield for one final time. The loss of not being able to have the traditional end of programme parties and nights out to celebrate. However, it is also a time of joy, celebration and achievement to have made it this far, and I hope you acknowledge what you have achieved here today. When you started your internship in January, no one could have imagined what was to unfold in the weeks and months ahead with COVID. I know for many of you, that the last few months have been challenging, difficult, and a real test of your resilience. You have made many sacrifices. You have been away from family and friends for long periods. You have had housemates not wanting to share accommodation with you. In some instances, family wanted you to move out. Many of you have spent many weeks and months living alone. You have had family being fearful of seeing you. In addition, family being worried about your well-being. You have also lost the social aspects of internship, the ward nights out, the impromptu after-work get-togethers, the fun, the crack, and the usual mischief interns get up to. As your program lead, I have been inspired by your journey through internship, and it has most definitely confirmed that you are in the right profession. We have received continual positive feedback from clinical and patients on the valuable contribution you have made to patient care. Your selflessness, your willingness to help, your courage to continue caring, and the compassion you have showed and the sacrifices you have made have not gone unnoticed. As a group of interns, you have displayed the qualities of excellent nurses. You have demonstrated high standards of professionalism. You have demonstrated diligence and attention to detail in your work. You have displayed excellent communication and interpersonal skills. You have highlighted your quick problem-solving skills on many occasions. You have been action-orientated. You have demonstrated resilience, integrity, courage, determination, and strength to keep going when things got tough in clinical. You know when to take charge and you know when to call for help. However, additionally, you have demonstrated in spades care, compassion, and empathy for your patients, their families, and your fellow co-workers. This intern experience will shape your future. And from the qualities you have displayed, I know the class sitting in front of me are going to accomplish great things in your careers to come. Some of you may become clinical nurse managers, clinical nurse specialists, advanced nurse practitioners, nurse prescribers, researchers. Maybe you'll go into education and become a colleague of mine here in UCC. Maybe a CEO of a hospital, chief nurse in the Department of Health, or go work with NMBI. Maybe you'll go down the road of e-health, telenursing, or develop a new technology-focused platform to develop nursing. Alternatively, maybe you'll use your voice in a different way. Maybe, do we have a future Minister of Health here in the room? A future Taoiseach? The possibilities are endless. So please, as your programme lead, I ask you, please be proactive and take ownership of your career. Do not wait for opportunities to fall on your lap. Go seek them out or create your own opportunities. Take the initiative and seek out shadowing opportunities to learn more about different roles. Arrange informal meetings with different sectors that you're interested in. And remember, if the door slams shut and you are told no, pick yourself up, keep marching forwards, and just find another way to open the door to progression and opportunity. You will get there, that I know. While the title of today's gathering is called an end of programme celebration, it could also be called a retirement ceremony. Because the reason being is that very soon you're going to retire a title you have been using for the past 4 years. That's the title of student nurse. Soon you will be introducing yourself as the staff nurse, and soon again the preceptor to our current undergraduate students. Times are changing, but I am really looking forward to having you officially as my colleagues and welcoming you into the family of nurses. Just one more exam board left. I need to take a moment to acknowledge the team here in the school who have been part of your journey to this day. To all the lecturers, module leaders, practice module leaders, programme leads, allocations team, GO3 admin team, clinical skills team, directors of undergraduate education and practice, and head of school. Thank you. Your work and dedication over the years is demonstrated by seeing another group of students fly the nest and qualify as nurses. To our health service partners, thank you for your ongoing collaboration and teamwork. Thank you to the preceptors, clinical nurse managers, CPCs, ALOs, practice development and directors of nursing. Thanks to your hard work and contribution, another group of students are ready to take their place as staff nurses in your clinical settings. Finally, to you, the interns, I want to thank each and every one of you for the contribution you have made and continue to make in clinical, especially during COVID, and I mean that. We here in the school applaud you for your contribution and are so proud of all your achievements over the past 4 years. Remember this, that nurses are the heartbeat of our healthcare system, and this has been clearly demonstrated during COVID. Remember, nursing needs you. Nursing needs your fresh ideas and perspective. Nursing needs your passion and creativity. Nursing needs your action-orientated approach. Nursing needs your entrepreneurial minds, because nursing needs your solutions to our healthcare challenges, because you are both the present and future of nursing. So, go forth, conquer the world, live your best lives, and most importantly, stay fabulous. Thank you.